Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about when do you use herbs and when do you use antibiotics? And the answer is it depends on the patient, and it depends on the patient's belief system. If a patient believes that antibiotics are evil, they will never work. Likewise, if a patient believes that herbs are not strong enough, they will never work. The patient has to believe in the treatment that we're doing, otherwise, it's not going to work. In general, I like to start, well, it depends on the patient, but the more fragile the constitution, the more you're going to have to ease patients into antibiotics. So you might have to start first with, some lymph drainage, then some detox, then maybe some immune support, and then you really start to go after the pathogens. It really depends on the patient. It's very individual, and that's why personalized medicine is so important. One size does not fit all, ever, never. In the 8,500 patients I've treated, nobody has been the same. So, that's another really big clue. Some people prefer heavy on herbs, light on antibiotics. The other people prefer heavy on antibiotics, light on the herbs. Some people like a combination of both. I think that works the best, personally. And a lot of people are very worried about what antibiotics will do to the microbiome, and it's definitely a concern. But that's why I usually use a number of different probiotics, and I rotate them. And in the almost 27 years I've been doing this, I've only seen C. diff twice in my entire career in 8,500 patients. And those two patients didn't take probiotics. So probiotics are really, really, really important. And I try and tell people you have to do it. I know it's a pain in the neck. I get it. But, it's much more of a pain in the neck if you get C. diff and you have to go into the hospital. Then it's really bad. So C. diff is difficult to treat. Oftentimes you need a fecal transplant. It's just, you don't want to go there. So where to start a patient is really an individual thing. You always start with one antibiotic, then gradually 7 days later add another if they can handle it. Then gradually you add another one. You never add in another antibiotic if the patient is herxing. You wait till the herx stops, and then you add the second or third antibiotic, depending. It's just too hard on the body, and the body's already struggling to try and detoxify and get rid of stuff. So you want to always honor the body. The body's always talking to you, telling you, don't do this, and you have to listen. And sometimes you have to take notes. Sometimes you have to keep a journal. And but you should welcome that. That's how you figure out what you as in YOU, need. And it works. I've been doing this for a long time. And if the patient is present in their body and they know, oh, rifampin's making me sick. Oh, Bactrim makes me pee too much. Oh, Zithromax makes me cough. Well, then those are probably not the right drugs. I mean, it could be a herx, and that's my job to figure that out. But there are patients that have idiosyncratic responses to antibiotics, and you have to honor that. And therein lies the art of medicine, and that's why it takes so long to train as a physician, and that is why they call it the practice of medicine. I hope you found this information helpful, and I hope you have a wonderful day. Take care.